Hi, my name is Bethany Paris, and I'm a second-year medical student at Oklahoma State University's College of Osteopathic Medicine at the Cherokee Nation. And today I'll be presenting on equity reporting and HIV PrEP systematic reviews. So for a little bit of background, pre-exposure prophylaxis, which I'll be referring to as PrEP for the rest of this talk, is a medication regimen developed specifically for a human immunodeficiency virus, or HIV prevention. So PrEP is a really effective regimen that can reduce HIV transmission through sex by 99% and through IV drug use by 74%. This is particularly relevant from an equity lens because HIV disproportionately affects minority communities. So more affected communities include men who have sex with men, along with Black and Hispanic populations. Other factors that may play a role in HIV transmission as well include location, religion, and mental health. We'll talk about more specifics within our methods section, but the Progress Plus framework was created by Evans and Brown in 2003 for the specific purpose of health equity reporting. Equity reporting within systematic reviews is really important because it can be used to provide culturally informed approaches to medical care, and it can serve as a guide for future medical treatment and research. So our objective today is to assess equity reporting in systematic reviews of PrEP utilizing that Progress Plus framework. For our methods, we conducted a search of PubMed, Embase, and Cochrane database of systematic reviews, looking for systematic reviews and meta-analyses about HIV PrEP. Those included were then analyzed using this Progress Plus framework. So the Progress aspect is an acronym that stands for place, race or ethnicity, occupation, gender or sex, religion, education, socioeconomic status, and social capital. And that plus aspect encapsulates age and disability, which are two other variables that we felt were very relevant within this discussion. We then analyzed the frequency of reporting of each of those domains, as well as individual sub-analysis of each of those domains within all of the studies we looked at, and we analyzed all of this data conducting a linear regression analysis. So here are results you can see in this table on the right. After appropriate screening, our sample consisted of 36 systematic reviews and meta-analyses that assessed PrEP utilization in some way. The items that were most frequently reported from this Progress Plus list were gender or sex and place, which were both reported in 34 out of 36 studies analyzed. Age was also pretty well represented, so it was reported in 30 out of 36 studies analyzed. The least commonly reported items were religion, which was not reported in any of the studies that we looked at, disability, which was only reported once, and social capital, which was reported in 6 out of those 36 studies. Of that number of 36 systematic reviews and meta-analyses that we looked at, only 19 of them conducted any subgroup analysis at all. Most commonly, it was gender or sex that was sub-analyzed when that did occur, and gender or sex was sub-analyzed in 16 out of those 36 total studies, 19 doing any sub-analysis. So for the significance of our findings, it was pretty relevant that none of the systematic reviews or meta-analyses analyzed in our study included all of the Progress Plus domains. So clearly there are still some equity gaps present in this literature about PrEP. This is particularly important because in the real world, no individual's health is decided by one single variable, right? So it's the combined effects of all of these Progress Plus domains, plus other factors that we weren't able to analyze in this setting that are what's going to determine any given individual's real world health. And so we want to make sure that we can have as much data on all these variables as possible. We looked at specifically systematic reviews and meta-analyses because they functionally serve as agenda setters in their field. So if we don't have a good level of equity consideration at this level, it may be harder for researchers conducting primary studies to incorporate equity into their design. We believe that further research in equity reporting using frameworks similar to Progress Plus or Progress Plus itself is necessary both in PrEP research as well as other fields, so we better understand the populations that we're studying. In conclusion, while nearly all of our samples reported on gender or sex and place, most of those other Progress Plus items were lacking from a majority of our studies. This lack of reporting of these Progress Plus items reveals a need for further assessment as we look to reduce barriers for PrEP usage and improve overall HIV prevention strategies. In conclusion, here are our references. So these are on the left, as well as my contact information on the right. So if you have any questions or thoughts, I would love to hear from you. Thank you guys so much.